Let's bring in Dr. Janette Nesheiwat, family and emergency medicine doctor and Fox News medical contributor. You have treated an awful lot of COVID patients yourself, doctor. What about that? If you've been fully vaccinated, this is the argument that Dr. Fauci got into with Senator Rand Paul on the floor of the Senate. Why do you need to wear a mask after you've been vaccinated?
Well, good evening, John. The reason why we wanted to wear a mask even after you've been vaccinated, even if it's been at least 2 weeks since your last vaccine, is because we got to remember, for example, Johnson & Johnson is only 72% effective. Moderna, Pfizer, 90% effective. It can significantly protect you against symptomatic disease, and it can drastically reduce your risk of transmission to others, but it's not 100%. With Johnson & Johnson, there's still a 28% chance that you can pick up the virus and spread it to others. So it's just temporary, and that's why they say when you're out in public, if you're traveling, if you can't physical distance, then just wear your mask, because we only have about 20% of Americans that are fully vaccinated. So until we can get that number higher, just continue to practice with the safety guidelines of physical distancing and wearing your mask until we can get more Americans vaccinated, especially with the variants that we see emerging, the UK variant, the Brazilian variant, that are creating these spikes in some of the states like Michigan, Rhode Island, New Jersey, here in New York as well. We're seeing an uptick in the number of cases, most likely because of the variants.
The moving average of 7-day COVID cases back on March 1st was about 4.3% of the population. Now it's about 4.9%. Why is that? If we're vaccinating so many people, we've got a third of the country vaccinated, why is the number of cases on the rise?
Yeah, it is. It's creeping up a little bit. And there's for several reasons. Number one, travel. We've got the spring break. We've got Easter. We've got Memorial Day coming up. So travel, then the concern for the variants. Remember, the UK, the variant, the B.1.1.7, 50% more contagious and 60% more lethal. So we are seeing an increase in the number of cases in certain parts of the country, and it's in the younger population as well. And on top of that, we're seeing almost a 30% increase in hospitalizations in those in the ages between 20 and 29 because of the variants that are emerging. So that's why it's important to continue to vaccinate as quickly as possible, as many Americans as possible, and at the same time wear your mask when you cannot physical distance until we can get those numbers up.
I want to put up, you mentioned that UK variant, and I want to put on screen, if we can get it up there, the numbers from the states that are most affected, seeing the most of the UK variant. Florida shows a little over 2,300 cases, Michigan at 1,200, Colorado at almost 900, California at 800, and Massachusetts at 712. You said that that is very contagious and also very much more impactful, very more often fatal.
Yes, and that's why I think it's a great idea to expand vaccine eligibility to the younger population. I see in some states they're opening it up to age 16. If you're 16 years old, Pfizer is a vaccine that you can receive as early as 16, with Moderna as early as 18. So that's why it's important that we're expanding eligibility of the vaccine to the younger population, because they are the ones who we're seeing it in now, and they are the ones who are spreading it. But if we can continue at the pace that we're going now, with about 3 million vaccines daily, and even try to get that number up, then we're going to be headed in the right direction and hopefully reverse the upward trajectory that we're seeing in over half of the country right now.
Well, we've vaccinated, or at least a third of the country, roughly 31%, has at least one dose of the vaccine. How many more people do we need to vaccinate before you reach that herd immunity that basically causes the virus to die out because it can't find any hosts?
Yeah, well, historically, we want about 70 to 90% of the population to have antibody protection. And you get that either with vaccine or having naturally acquired the disease. But I think it's important to not just focus on vaccinating Americans. I think it's also important to have a protocol in place where we can potentially early identify and detect disease in the community so that we can prevent any outbreaks like we see, for example, in Michigan or Rhode Island or in New York. We want to prevent outbreaks. We want good surveillance. We want good viral genomic sequencing, and we want to continue vaccinating as many as we can. I think collectively this will help get us to the concept of herd immunity a lot faster.
I want to put up a quick slide of the vaccine trials that are underway among young people in this country. Pfizer has been shown to be 100% effective for children ages 12 to 15. Under age 12, the Pfizer vaccine is still in trials. Moderna is also in trials for under 12 and 12 to 17 years old. But you're saying that the vaccines are proving to be effective among younger people, and that's going to be a necessary part of the program.
Yeah, I think so, John. You know, kids, children, they do contribute to the pandemic, and they play a role in herd immunity as well. We have about 4 million children that we know of that have tested positive for COVID. And although they may not get very sick, they can become sick, and they can transmit the virus as well. They can transmit it to their parents, to their siblings. So they do contribute. I think it's a good idea to get children vaccinated, especially teenagers. They tend to transmit the virus more so like adults do. Now, under the age of 10, not as much, but between the ages of 12 and 15, Pfizer found that every one of those children that received the actual vaccine did not pick up COVID. So those were really encouraging findings, and I'm hoping within the next few weeks we'll get FDA approval and maybe even start vaccinating these young folks in the summertime so that they'll be ready for school back in the fall.
That will be a welcome relief for millions of parents in this country.
Yes.
Dr. Janette Nesheiwat. Doctor, thank you.
Thank you, John.